Well, let's go ahead and jump in. I wanted to just quick introduce how I met Denise for the first time. So after my second baby, I went into my OB, my midwife, and I'd had a little bit of abdominal pain and like a kind of a seized muscle in my abdomen. And they were like, oh, here, we'll just recommend this physical therapist. You can go meet her. So I went in and I opened the door to her clinic. And the first thing I thought was, oh, I'm going to be like taking my clothes off and putting on a gown. I wasn't expecting that. And after she got in, you dug into me, you worked so hard. And when I left, there were two main things I think I took away. First of all was that I had not been doing Kegels right at all. It's way more than just stopping my pee. And the second thing was I was blown away how you knew my body, and just that I was like, every woman needs to go to a pelvic floor specialist, especially after having a baby, just to get checked in, see how we're doing. So anyway, there's my quick introduction. I'd love to have you share how you got into the profession of physical therapy with an emphasis on pelvic floor.
Yeah. So I went to a really awesome school in St. Augustine, Florida. Stanley Paris was the first physical therapist to come to the U.S. to bring manual therapy from New Zealand. And therefore, I was fortunate. So years ago, I learned how to manipulate the body and to really understand biomechanics and look at the whole person. And I was in my first job, I was seeing 22 patients a day. So if you can imagine how quick the pace was, it was 3 people an hour. Wow. I thought I was going to die. And I would be like this, I got to go to the bathroom. Are you okay with that? And they would go, yes, go to the bathroom. So I'd be in there, I'd run in, push my pee out, stand up, and I would leak. And I'd be like, what's up with that? That is fascinating. What's wrong with me? So I was reading in a PT magazine, saw that in Portland, there was a pelvic floor introductory course on incontinence. So I went to Portland, took a class, learned that my muscles were way too out of control and tight, because they put me on an EMG, which is biofeedback, a little machine that tells you the firing of your muscles. And that is how it started. And I suddenly got fascinated with it. And I thought I could do this. And so I shifted from being more of an orthopedic sports medicine interest into women's and men's health.
Oh, I love that so much. And incontinence, just to clarify for everyone, is when you can't hold your pee, or is that right?
You actually leak on cough, sneeze, laugh. So intra, meaning within your abdominal pressure, cannot be overcome by your pelvic floor strength. Therefore, you squirt or you leak, stress incontinence.
That is, well, I'm so glad that you got into the profession, because you've changed my life. So
I love it.
Well, why don't you go ahead, like tell us a little bit about what pelvic floor therapy is and why it's so important.
Okay, well, pelvic floor therapy is important for so many reasons, but purely, and I did script myself a little bit, so if I occasionally look away, please know that. that this is a really delicate area, yet very strong. So it's the place where we have a lot of intimacy and defecation, urination, but yet they're skeletal muscles. So the same muscles that I find in my bicep, I also find in my pelvic floor. Any type of movement that I do, any translation of in and out of a car, up and down from sitting to stand, walking, there is translation through this area. So these muscles are being utilized more than we ever thought. Also, what's more important than sphincter support, thank goodness, sexual capability, as well as your ability to urinate and defecate, but most importantly, give life. So women birth through this area of our body. Also, the thing that's frustrating to me is why, I listed a lot of really important things, but why is it that no one talks about this? So I'm happy that you asked me to talk, because I feel like if we as women just network within each other and within our own group, we don't really need practitioners. We need each other to keep spreading the word that let's talk about our pelvic area and let's get it better.
Amen. Thanks for helping us open up that conversation. I too, I think it's so important. I'm going to go ahead and list all the things that are listed on your website that you can help treat. And do you have like a diagram of something you can show us as part of it too, so we know what we're looking at?
Yep.
Okay, perfect.
I don't have that list of things, but on my website,
I'll read it. I wrote it down. So
okay.
These are some of the things that Denise treats: pelvic floor disorders, pelvic organ prolapse syndrome, urinary or fecal incontinence, vulvar and rectal pain, pelvic pain, including endometriosis, surgical complications, cancer, pain with intercourse, breast cancer pain, pre- and postpartum complications, including C-section, scar, diastasis recti, and more. I just think that is such an amazing list, and so many things that I think are so common that a lot of women struggle with, and we don't even know where to go to get help.
Yeah. So the way you can start in your community is, first you could Google pelvic floor physical therapy. Okay. Let's say you come up with a blockade, or you're just not sure who's certified, who's good, who's not. I do love Yelp. I feel like Yelp's pretty honest. You're going to get a good feel about those people. But you can go to apta.org. So that is the American Physical Therapy Association. On that, there's a link that says Find a PT. So you would then put that in and put in practice focus, which is pelvic health. And then after that, you would then put in specialist, which would be women's health. So you're going to get a list of people that pay into this, I should say, organization to keep us well informed. Not saying that if someone's not a member of the APTA, they're not amazing, but it's just a nice organization to get your continuing ed and also get out to the public through this way. So I'm not certified myself, but you'll find that some people have a WCS after their name, which is Women's Clinical Specialist. So I would look for that. I would look also for orthopedic clinical specialist. That would be someone that has an orthopedic emphasis. So really understanding the body biomechanics and possibly a manual therapist, because one of my approaches is to look at the whole person, and that comes first, looking at the whole, and then we then are intricate in the sense that we hone in on that pelvic floor and its relationship to the whole body. So key to success, in my opinion, is looking at the whole person.
Which I totally agree. It's been fascinating as I've gone to see how everything is affected by everything else. And when there's one problem on one side, it's affected my whole side of that body. And so fascinating to see. So what do you recommend if there isn't a pelvic floor specialist or someone orthopedic specialist in your area?
So if you go to the Global Pelvic Health Alliance on Facebook, they have a Facebook page, as well as www.pelvicguru.com. You can find lists of other physical therapists and ones that do telehealth. So sometimes there are opportunities to help via education and training over the internet without touching.
Oh, awesome.
Ideally in person, but those are two resources for you to look into, and they can also give you additional lists in case those people aren't an APTA member.
Oh, awesome. That's so great. And so a couple of questions came in as well about how do you even know if you need to go see a physical therapist, a pelvic floor specialist? What are some common symptoms that trigger people to come in?
So some symptoms may be that I have pain with sitting. I have pain, and this is pain in the private area, pelvic area. And in a moment, I'll show you the anatomy with a little 3D approach. Also, like I'm having difficulty defecating. I have pain. I had a slight tear and I had some bleeding, or I have urination issues. I leak when I cough, sneeze, laugh, jump. I'm doing CrossFit. Oh my gosh, all of a sudden I felt my organs fall down and then they came back up. What is that? Or I went to go wipe and I felt something bulbous coming out. What is that? Is that my organ system? Or I'm an athlete and my hip's not functioning very well. Oh gosh, and that left hip is also being hurt during intercourse when I need to open my legs to do that. Also, how about pre and post delivery of a child? A lot of times this is not offered. Therefore, you can ask for a referral, but you can also just search it out for your own patient education and training. In California, we are now a direct access state. There's a lot of states that have the ability for a physical therapist to see you off of the street, meaning you didn't have a doctor's appointment or they didn't refer you, but we could continue, or we could evaluate you and then decide what your needs are. Of course, I always tell people, I love working with other practitioners. I work with massage therapists, doctors, chiropractors, acupuncturists. But I always love that you check in with your doc to say, okay, I'm seeing Denise. The other thing you can do when you are seeing a PT is sign off on the consent to have a note sent over to them to inform them.
No, I love it.
Let me see if I missed anything else. It looks like I got everything. Surgeries. Let's say you've had an old appendectomy on the right side of your lower quadrant, and then all of a sudden it's getting sticky and painful, and gee, you know what? I need some scar tissue release. So I also look at that, C-sections, post-hysterectomies, that sort of thing.
No, I'm so passionate about that because I feel like after having a baby, your body's been through something so crazy. And so many women are like, oh, I just pee after having a baby for the rest of my life. Like it's just something that's going to be happening. And after going to you, I'm like, that's not the case. We can help heal our bodies. So I love that.
Let me grab my model just a moment.
Perfect.
So when we talk about the pelvis, we are talking about this bony osseous structure that has a front section, which is right here is where your long femur bones or your upper thigh bones go. And then here's that pubic symphysis. You hear about pubic symphysis pain sometimes during delivery and or in the process of being pregnant, because there's a lot of stretching that happens here, as well as turning it around. Here's that sacroiliac joint you may have heard about. And then here's the sacrum, a lot of little nerves that come out of here, and then lumbar spine. So right here is where your big gluteal muscles for walking happen. Your pelvic floor has muscle groups. First layer is the urogenital diaphragm. All you need to remember about this layer is it's sphincteric, so my ability to close off and open at the urethra, vagina, and the anus here, as well as open up for intercourse, defecation, urination, delivering a child through this area. And also remember there are nerves here, so sensory. So this is where sensation happens and where the clitoris has its innervation and stimulation. It's a muscle group that is supposed to be nice and tidy, but some of us can get overstretched through here post-delivery. That's why you would go to a PT and they would help you do some Kegels possibly. Or maybe you had a little tear here and you suddenly got tighter, that we could work on massaging through that area. If I take that off, your next layer in is called the levator ani. Levator ani is quite large, as big as pretty much my hand. And this is a muscle group that is a lifter. So the previous muscle group was a closer, and this is a lifter. So sometimes we find that this has closed too much and lifted too much into the canal, therefore making the vaginal opening a little bit more narrow. So my job is to try to open that up to create space. And there may be scars in this muscle group. Don't forget that little tiny bone. That's the coccyx bone, if anyone wanted to know. Why is it so important? That's the origin of your pelvic floor. So your pelvic floor originates there, and then it comes forward and attaches at the pubic bone. Lastly, this is quite interesting. This is a hip rotator. Let's get right up in there. So this muscle allows your hip to rotate out. So we have found too that possibly athletes and runners have problems, and this particular muscle is sticking out into the canal and possibly getting hit during intercourse. Or it's a source of pain. It does refer up here. So people go to the doctor, I have ovary pain, and then they ultrasound, I find nothing. That's a perfect time to go see your PT.
No, that's so good to know. And that kind of leads us into our next question. You answered a couple of them, but are there any other causes of pain during sex that you would add to what you just said? And then how can pelvic floor therapy help with some of those issues?
Okay, so that first layer of your pelvic floor, your genital diaphragm, basically we have two sets of glands on either side that create moisture, and sometimes those can become inflamed and painful. So that would be sandpaper feeling, people will say, or I go to wipe and it stings. So it's important to talk to your doctor if you have things like that. Also, too, if estrogen levels drop, sometimes we can have discomfort and a burning and a stretchy skin type feeling. Also, you'll notice in this layer, it's nice and tidy. So this is what we would stretch, and we could use dilators, which are cylinder-like structures that are graded in sizes, and you place them in through the pelvic floor, and you do little swiping type techniques and depth perception, trying to get to see how far I can handle something through my vagina, and then graded. So over time, you can increase and set that goal for being able to do that. Your next layer, again, sometimes this layer can also be just pulled up and too tight. So we go in and massage this layer. And we also teach partners to do this. I mean, really, this week I've had 2 different partners come in, both young and 60-year-olds. And they were so pleased because for years their partner has been in pain and they didn't know how to help them. So I think what's key is, like, I always include the partner in this.
I love that.
Let's see if there's anything else I can tell you. Sometimes just, intercourse can be painful positionally. So looking at that. And then also, let's say you have a deeper organ problem. The end of that vaginal canal is where the bladder, urethra, and the cervix and uterus hang out, as well as the rectum on the back left side. So if there's a problem with those structures, then that might be a source of your pain. That's when we really need to ask the doc for help.
No, I love that so much. And I think it's so sad that, sorry, little boy just woke up from a nap, that so many people go through their life thinking that pain during sex is normal, and that's not. So the next thing to talk about is, so how do you know, especially with like prolapse, I feel like a lot of people would automatically jump to surgery. How do you know when it's appropriate to do pelvic floor versus surgery, or when surgery is actually needed?
Okay, so if let's say you're at home and you're showering and all of a sudden you feel that your organ is pretty much outside of your opening, then that is a immediate doctor call. Okay, and a urogynecologist or a urologist or a gynecologist can look at that to help evaluate where you're at. But let's say you just are noticing some, I call it bloopy feelings. Okay, some people say trickling or air. A PT can evaluate where you're at. We check you both in laying on your back as well as standing, and to see if you have support. Sometimes those organs are much better laying on my back versus standing up. And then what we do is we analyze the muscle groups of the abdominal wall combined with the pelvic floor and see how we can support that structure. And if we don't improve, then we would then call on physicians or think about surgical strategies.
And I love that, to try physical therapy first, because surgery is a huge thing. And if you can do it without, that's so awesome.
Better. Yeah.
And so one thing that I've come in for is to help heal my body after childbirth. So what are some things that you do to help postpartum moms? And also, when can you begin after childbirth? How soon?
So they say that, even like when I go to these classes and learn stuff, they say that you should start breathing inhaling and exhaling, cinching the waist on exhale right after delivery. So you can start encouraging closure of that abdominal wall, as well as doing Kegels. Now, listen, if you've had a slightly traumatic birthing experience and there's a lot of pain, or there's a scar there, or I should say a stitch there, maybe that doesn't sound amazing, right? But breathing into the tissue gently to allow a beautiful light stretch might be a great idea. Typically, I see people 6 weeks postpartum. However, I think that it's up to you what you want. We can work around your body. I don't have to do intra-pelvic things right away. We can work on structure, looking at the alignment of the pelvis, improving strength right away, soft tissue massage. I do a lot of abdominal work where I work from the back toward the front to try to get that waistline back immediately. You know, I mean, think about our culture. Like we are just sent home. Good luck. But I think about other cultures, like they bind people and they like know what they're doing and stuff. So my theory is culturally, let's start going to massage and to PT. Let us help. You know what I mean? Because we are lucky. We have that here. There are countries where there's no PTs for miles.
Yes.
But usually you can find a massage therapist and or a PT to help you. So
I remember when I came in. Oh, I was just going to say, I remember when I came in and just like after birth, my rib cage had kind of expanded. And the very first appointment, you kind of helped cinch me up. And I went home and my husband was like, I can see it. Like,
well, that's what's super fun. Like the most fun I have, to be honest, is taking a rib cage and going and holding it and talking to you guys and saying, we are just telling it no more. Because that last trimester, it kind of goes forward and out, and it allows the ascension or the elevation of the uterus. So, by the way, when you're done, you're done. That's my theory. We're done. Let's close the doors.
Baby's out of there. Yes, totally. And so some people reached out as well with, especially after birth, but it can happen if you haven't had a baby as well, but just not being able to hold their pee during certain activities. But it's fine the rest of the time, but maybe jumping jacks or jumping on a trampoline. What are some exercises that you recommend as a therapist to help with those?
So Kegel exercises, Dr. Kegel invented these where we are contracting those muscles of the pelvic floor. And there's two different qualities of movement. There's quick movement and long holds. And so practicing 10 count, 10 relax, and then 2 count, 2 relax throughout your day. I like to do about 10 to 15 in a row 3 times a day initially. And you're trying to coordinate exhalation with closure. Inhalation is more relaxed and open. And then if you find that me describing it like this, you're like, what? Then you would go to a PT. We teach you, not a big deal. The other thing is we have devices that are amazing. We have a small electrical stimulation device with a tampon-like probe that goes through the canal, and it can help grab and restore your muscles quickly. So what's nice about that, you can rent to own, and you can do it every day, even twice a day, depending on your motivation, and start building the strength back. Now, of course, you wouldn't do this if you're still leaking fluids from birth and or if you have your menstrual cycle. But, I mean, there's so much out there to help women.
No, I love that. And I learned so much about Kegels because I always thought it was just like closing while you're peeing, like that muscle. And it's like your whole abdomen, you're cinching by your rib cage and your abdomen.
You're drawing things together and using the deeper layers and lifting. And that's also front to back, right? You learned that my pelvic floor is my tailbone to my pubic bone. That's, that's as big as my hand, my little hammock.
Can you explain really quick how you would teach someone to do a Kegel?
Yeah. So what I like to think about is you've got a figure 8 and then a triangle. So what I'm trying to do is to take this triangle and make it more close together down the center, which is where the perineum is. So the area between the anus and the vagina. But I'm also interested in pubic bone to perineum. Like a bird's beak, I'm going to pinch and draw the worm in. So drawing the worm in is that second layer, that lifting layer. So you're first closing and then lifting, exhaling and drawing up to your lower abdomen. One of my patients told me something awesome. So here's the triangle, here's the perineum. Pretend that you have two horses' reins on either side. You're going to draw the reins up to your lower abdomen or your umbilicus. So if you can visualize that, those are just some visuals that work for my patients. But ideally, in my opinion, everyone should go to a PT once.
I agree. Just to learn how to do it and check where your body's at.
Maybe that's the only thing you need help with.
Yeah, totally. So let's see. Another tip. So you talked about looking online already. I think we kind of answered this about if you're not in California, can't come to Denise, looking online, looking for that WCS on the website, or any other tips about how to find a good pelvic floor.
So I think just like first Googling, Yelping in your community, you don't find anyone, apta.org. If you don't find anyone there, there's the global, I'm going to always say it wrong, Global Pelvic Health Alliance. Tracy Sher is a PT, SHER, that started this. I'm a member of this group, and it's international.
Okay, awesome.
So they have a member, list, which is amazing. And then also www.pelvicguru.com. There's just, you know what, as I'm searching, it seems like people are starting to wake up, and there's a lot of PTs that are starting to see that this is a viable, fun way to be a PT, to help people in very important ways.
Oh, I love that. It's so good. I'm so glad the conversations are opening up more. So a big question for a lot of people, I feel like too, when you think about seeing a specialist, is the cost. So can you just give us an idea? Of course, it's different depending on the therapist.
So you're, when you go to a pelvic PT, sometimes, which is really nice, is you're able to spend a little bit longer time if they're in private practice. If you're in a larger group, sometimes they're limited to the amount of time they can spend with you. So obviously the amount of time is cost. So in PT, it's, billable units, we call it. So like, for instance, to see me, it's $250 for an initial evaluation, and it's $200 after that. And that's for a whole 60 minutes of my attention. Typically, I see someone once a week for 6 weeks. That's my magic number. And I really work hard to evaluate and get a nice problem list, and then goals set. And then each week we have to move toward those goals. But that's California, right? So you have to look at the state and just do your research and find out, call around to several people. But at the same time, insurance pays for this. Okay? It's very important to know that just because it's in my private area doesn't mean that it's not covered.
So just looking for which PT might be with your insurance or
exactly
network. No, that's
versus out of network. Like, I'm out of network. I don't have an admin. I don't have a billing person. It's just pay as you go. I give people a super bill that they submit for their out of network benefit.
No, and if you can afford it, just to go once, even out of pocket, I would definitely recommend it. It's so worth it. We're going to go ahead and start wrapping up. I just wanted to end with one last question for Denise, that what is the most important thing you wish women knew about their pelvic floors?
Gosh, that I know I wrote the answer to this. I have so much to say. Can you imagine? I've been doing this a lot of years. I have a lot to say.
I know. We could have had this interview for like 2 hours.
So the most important thing is that your pelvic area is dynamic. Yes. Capable and strong, and stronger than you think. Also, it's not just a vagina. I'm in PT school, like, no lie, getting my first education and training, and I'm like, I thought it's just a vagina. I mean, seriously, it's not just a vagina. There's a lot going on here. Okay, we have to remember that. And it's a life force. It's your life force. And then as a female, your ability to give life force, which I think is really cool. And we need to take care of this area, give it a lot of attention, learn about ourselves, and empower ourselves to be strong females.
Amen.
And self-love.
Yes, so true. Thank you so much for taking your time to do this interview with us. I think it's so important for women to know about their bodies, to take a look, to know that it's normal and beautiful. And thank you so much for helping us learn more about our pelvic floors.
You're welcome. And if you need me, my phone number is 408-307-0901. Even if you have a quick question, as well as a website, denisealberto.com. You can check it out, more information.
I love it.
Thank you.
Thank you so much.
All right.
Bye.
Bye.